GL. From the Cold City Zoo. This family consists of 4 members. This is Genki, 37 years old. Today's topic is a result of Genki's dental work done last Monday. So far, Genki has her pus coming out of her cheeks and swelling of her cheeks due to her cavities. Genki has almost no teeth in the back due to decay. Her front teeth also have numerous cavities. And this is due to eating too much of the same vegetable and fruits as humans, which are too nutritious. Gorillas have very thin tooth animals, so if they eat the same vegetable and fruits that humans eat, they will soon develop cavities. This is Kintaro, 5 years old. In consideration of the health of the gorillas, consider feeds them mainly grass and pasture grass. This time it has been 6 months since the last treatment. This is Momotaro, 23 years old. Momotaro is watching over Kintaro. Last time that treatment under anesthesia did not go as well as expected, and that treatment was not sufficient. Tip: currently Genki's teeth are not in a very bad condition. The treatment was done this time because it was decided that it would be better to finish the treatment as soon as possible. Kintaro has a new ball, maybe 2 more. A light blue ball and a light green ball. Since mid-January of this year, Genki has been receiving adequate injection training and separation training from Kintaro. And enough separation training for both Genki and Kintaro. The day before the treatment, Genki was required to stop eating and drinking. The day before the treatment, the zookeepers were very careful not to be noticed by the male gorillas, especially Kintaro. Kintaro is a little traumatized because he had been through the same thing 6 months ago. In fact, as explained in the video from the previous episode, Kintaro has not left his mother's side for the past few days. On the day of the treatment, painkillers and anesthetics were successfully administered. Genki and Kintaro were also successfully separated. After blood draw, EKG, and blood pressure, Genki underwent dental treatment. This time the zoo treated both cuspid teeth in the upper jaw where the path had deteriorated due to tooth decay. The zoo also extracted 1 right mandibular molar tooth that had deteriorated and was wobbling due to decay. It was not just 1 tooth, but part of a tooth that couldn't be extracted before. Last week, Kintaro played by himself as he pleased, but today he is still with his mother Genki. The hole in the side of her nose, which had been periodically draining a small amount of pus, was cleaned and disinfected. It is hoped that with the treatment of the canine tooth, the pus coming out of the side of the nose will disappear. That was the end of the procedure. This time Genki's condition was very stable under anesthesia and those involved were able to calmly complete the treatment well to the end. After the treatment, Genki returned to her family around 1 p.m. Not only Genki, but also the whole family who had been patiently waiting for her return were rewarded with flute. Kintaro immediately squealed when he saw Genki, as if he had missed her. After a while, however, he soon returned to normal. I believe that the treatment was like a root canal for a cavity. Even if all the cavities were removed, inflammation could still occur. It is significant that Genki was able to avoid heart disease derived from cavities. Kintaro stayed by his mother Genki's side for a while. Kintaro chasing after his mother Genki. Fortunately, today older brother Gentaro played with Kintaro. 繰り返しご来園中のお客様にお願い申し上げます。京都市動物園ではゴミ箱を設置しておりません。ゴミは各自でお持ち帰りいただきますようお願いします。皆様のご理解、ご協力をお願いいたします。This is Gentaro, 12 years old. Momotaro notices that Kintaro is looking anxious. Kintaro checks on Kintaro several times. Momotaro too.
本当あそこにもゴリラがいるよ。
最悪さっきのゴリラはつってる。
Kintaro takes a nap in one of his favorite places. Kintaro takes a nap by Gentaro's side. Italian rye glass.
Lunch at 1 p.m.
Well, I will share new information in the next issue as well.
Thank you for watching. Click the like button and subscribe to my channel please. See you in the next video.